In developing a social marketing project, it's really important to consider the whole of the methods mix. So this is much more than just developing some eye-catching posters or promotional materials. It's about thinking about developing a product or a service that's customer focused, making sure it's delivered at a location that's convenient to the target audience, and thinking about what exchange you're offering them. Coast is a great example of using the whole of the methods mix. Not only did they produce eye-catching materials, but they also developed a product and service that's tailored to meet the lifestyles of their target audience, which was young people.
We know that chlamydia is the most common sexually transmitted infection in the UK, and the numbers of chlamydia have been rising year on year, so part of the national strategy is to obviously reduce the incidence and prevalence of chlamydia infection in young people. Coast is part of the National Chlamydia Screening Programme, and Coast covers the district of Northern Lincolnshire, and primarily we offer chlamydia testing to people under the age of 25 years old.
For us, social marketing was really important because we needed to make certain that our services were innovative, they were young people friendly, and they were actually providing the young person with the best possible service.
Well, we know that in the past chlamydia testing were primarily available in places like centres for sexual health, usually within local hospitals and some GPs' practices. What young people clearly told us is they wanted greater access to testing. So now that we can test people for chlamydia with a urine test, that changes the way that we can scope out the service, because rather than wait for young people to come to us in a very clinical environment, we can now take that service out to young people and deliver it very differently. We offer testing in local schools and colleges. We've done events with the local football clubs so that on match days we can offer testing while people attend a football match, for instance. What we're very keen to achieve here is that we normalise chlamydia testing. We make it part and parcel of a young person's experience in looking after and being proactive about their own health care.
Young people can pick up postal free post kits at the libraries, at lots of different children's centres, at most pharmacies in the area.
As long as they've got access to a computer, they can go online, request a kit. That request then ends up back at the central office, and a kit's dispatched in a plain envelope. We've used incentives along the way really, and what we did was again listen to young people. So we took a range of goods out to young people to let them choose for themselves if we were going to incentivise what would be the most popular thing. So we've done wristbands, we've done mobile phone charms.
Probably one of the most successful incentives that we've done is what we call P for Pants, and we tend to do that at things like Freshers events and also some of the gay pride events it's been done at. And it involves basically people taking a chlamydia test but getting a free pair of pants, and the pants will say squeaky clean or tackles being tested. It's a little bit of a gimmick, it doesn't cost that much money, but it's really, really successful in terms of encouraging young people to test. We
identified the need to do some very specific work with young people, but absolutely crucially that was delivered by a young person themselves.
My role was basically to find out young people's views on the service, as well as mystery shop certain screening sites across the town that offer chlamydia screening for this service. We've come up with new forms for service users to fill in for the path lab, so their details forms, because the proposed new form seemed quite confusing. So I piloted it with some young people, one of the local colleges.
Whilst I could have employed one of my staff to go out and do that, I guess we get the feeling there that people tell us what they want us to know rather than somebody that's in the specific target age group that can be a critical friend and doesn't carry any baggage in terms of expectation. SMS text messaging is the most popular way that young people get the results. We use very subtle ways of telling them that they've got a negative test, so we say things like the Coast is clear, for instance, so they very clearly know that that test has been generated from us at Coast and that their test result was negative. When we initiate partner notification, it's obviously in dialogue with the person that's had a chlamydia test. So as long as they've given us one method of contacting their partners, whether it be an address or a mobile phone number, and usually speaking, we have really good outcomes. You know, we've had incidences where we've texted somebody at 8:30 in the morning and by 9 o'clock they've been in and been treated.
Hello there, do you want to come in?
Yes, sure.
We were very keen to involve our colleagues in primary care, so people around local pharmacies and particularly family doctors and GPs practices where quite significant volumes of young people attend, and part of the consultation was to ask young people whether they would be comfortable with routinely being tested, for instance, rather than them have to ask for a test for themselves.
We're seeing people really who were helping with contraception and things like that, so it really made sense for us to be screening these young people for chlamydia at the same time. When you come back, slip your sample into this envelope, stick it down and hand it into our reception. It wasn't something we particularly did before the course team actually helped us to focus on it and to realise the prevalence of chlamydia.
We know that the use of social marketing has increased our screening volumes, and that's really important to us. Since the programme's been running, we've achieved the national target for the uptake of screening every year. It's important that we build on that year on year, because as the targets increase, really so does the challenge.